Infectious diseases can cause serious disability and even death. However, as countries get richer, the numbers of people with these illnesses tend to fall. But in countries like Brazil, social mobility and changing habits bring other diseases instead, such as diabetes, as Ben Tavener reports from São Paulo.
The Montanini family have benefited from Brazil's rise to be a leading global economy. Like some 40 million other Brazilians, they've left poverty behind and entered the middle classes. Thanks to better healthcare, Brazilians are living longer. But now doctors are warning changes in people's lifestyles are leading to new health problems.
My dad used to swim in the river and play football when he was a child. My generation had more toys, but we still used to go outside and ride bikes and play tag. But today it's all about the TV, mobile phones and social media. I try to encourage my son Otávio to go outside when I realize he's been in front of the TV too long.
Otávio's generation now gets a far better start in life, but easy access to fatty and sugary foods is pushing up obesity rates, and not just in young people. Brazil's senior citizens are also starting to be affected by conditions that their ancestors never worried about.
Então, em maio deste ano, fui fazer meus exames preventivos.
I went to the doctors for some routine tests, and they found I have type 2 diabetes. Now I have to take tablets, and my diet has changed drastically. Eat less and restrict sweet things. I'm also doing more exercise. I try to do an hour of walking every day.
Some 14 million adults here now have diabetes, a figure that rose by 20% in the last year alone. Brazil has managed to lift millions of people out of poverty and into the economic middle classes. But that has come at a price, and now Brazil's doctors and nurses are treating more and more people with so-called first world health issues, with diabetes and heart disease at the top of the list. Dr. Egidio Dorea is a specialist in chronic diseases and has tracked the changes in his patients over the last 20 years.
The thing that changed was the lifestyle of the people. We became more sedentary and we began to eat worse. We increased our amount of sugar, carbohydrates and fat. The consequences of obesity are the increasing number of diseases such as diabetes, high blood pressure, high cholesterol, and the consequences of these diseases such as heart failure, kidney failure, and arthritis.
All of Brazil's generations have piled on the pounds, but with nearly 1 in 5 adults now obese, some experts believe Brazil could even be the fattest nation in the world by 2030. Hospitals have introduced free courses for patients to teach them how to improve their lifestyle. Back at the Montanini home, grandmother Lourdes has made pudding for the family. But doctor's orders mean she isn't having any. Her family keeps an eye on her diet and makes sure she takes her medicine at the right time. But not everybody has this level of help, so ending Brazil's love affair with fatty and sugary foods could prove tricky.